Well, good afternoon, everybody, and welcome back once again to the United Regional Chamber of Commerce's weekly updates. We try and bring you on some interesting guests and some interesting subjects. And this week, I'm very proud to introduce to one of our newest members from the Franklin area, Physicians One, a new medical urgent care facility that's opened up there in Franklin. And it is my pleasure today to introduce you to Dr. Jeannie Kenkare and Dr. Brian Cruz. Dr. Jeannie is the co-founder and chief medical officer, and Brian Cruz is the regional medical director. Welcome.
Thank you so much for having us.
Thank you.
Well, first off, we're going to go ladies before gentlemen, Dr. Cruz. Jeannie, tell us a little bit about you.
Sure. So I am the founder of Physician One Urgent Care. I'm a family medicine urgent care physician by background. We started Physician One Urgent Care in 2008 as a solution to the problems that we were seeing in our healthcare system, including long wait times in the emergency room, difficult access for patients to the care that they needed, and finding that patients were going to the wrong place for things that needed more acute care. So patients that showed up in the emergency room shouldn't be in the emergency room for things that can be taken care of in an urgent care setting. And at the time, there were no options for patients. So 2008 was our entry into the urgent care space. And today we are now have 24 sites, with Franklin being our 24th site. I'm just a little bit more about me, just to personalize this. I'm a mom of three. I've been, I'm, other than doing medicine and running this practice, I am a scout leader. I am active in our community locally at home, and I teach at the Yale Medical School. So that's a little bit about me.
All right. And Dr. Cruz, Brian, tell us a little bit about you.
Yeah, so I'm a board certified emergency physician. Prior to joining Physician One in the urgent care field, I worked up at emergency department up north of Boston for about 14 years prior to coming on board here. Some things I like to do outside of medicine: I like to play golf, run around, watch my son play football, plays varsity football for high school here in Massachusetts. And then watch my stepdaughter, who's a junior Olympic gymnast, for a lot of her meets as well. So in my household, we have 5 kids, so it keeps us very busy. So I can and understand a lot of other parents when they need, urgent care medicine, and they need other things to basically seek out care. So I'm definitely right up there with them and understanding that, a lot of times you need these kind of places off hours to get the care you need.
Absolutely. And urgent cares have become such an important part of our local communities, because, trying to get into an emergency room, trying to work that way is not only time consuming, but very difficult at times. And, one of the things I'm sure that you folks are working with as well is being short staffed. How are you doing staffing wise?
We are managing. I mean, this is a difficult environment. I think healthcare has been thrust into some very stressful and challenging times, and that has been reflected in staffing. But we're doing great. We've been able to sustain our staff and keep our doors open and have enough staff to safely and carefully, with a lot of affection, care for our patients.
Well, let's talk a little bit about some of the services, because as you mentioned, there are a lot of things, medical attention that's needed, that you don't need to go to the emergency room, or you don't need to go to your primary care. Now, am I correct in saying that, you have x-ray services and such things at Physician One?
Yes, we do. So we have radiology technicians on site, so we can do most any x-rays that you would need. We do offer, basic point of care testing, such as stress tests, COVID testing on site for rapid antigen tests. We can test for mono, for urinary tract infections through urine. So we have a lot of different services that we can offer online there in the center.
Well, one question that came up to me from some of the large companies there in the Franklin area is, do you offer drug testing?
We do. So we work with a lot of employers to do some of their drug testing as part of their pre-employment physicals or regular ongoing screening and evaluation. So if there's employers that are looking to, looking for those types of services, including drug testing, drug screening, physicals, annual evaluations, they should reach out to us and we'll look and see if we can help them. We do a lot of that work.
All right. Well, give me a couple of examples of, what I should go to physician one for instead of going to an emergency room.
So I think some of the things that basically you can see with us is, if you have a sore throat and you want to rule out strep, you rolled your ankle and you want to make sure there's not a fracture there. You had a laceration on your skin and want that fixed. Or maybe that you have some concerns about exposures for COVID or exposures to other diseases. A lot of times, sometimes it's about just reassurance for the patients. And we're a good first stop to kind of either do some testing in center or some good reassurance and kind of education around the patient's concerns.
And I'll add to that just to, I think the ER is a place for patients who need the highest level of care for the most acute things. So if you think you're having a heart attack, if you think you're having a stroke, those are not things that should be in any urgent care center. Those should be in the emergency room. But if you have an injury, if you have an illness, if you're able to, kind of support yourself, walk in for any of those types of illnesses or injuries, we're most likely going to be able to take care of the patient. We can always evaluate the patient and determine, hey, this needs a higher level of service. And if it does, send them on to the emergency room. But I would encourage people that think that their symptoms are consistent with something more severe that's life-threatening, like a heart attack or a stroke or something, limb or life-threatening, we would say go to the emergency room.
Now, how about one of the big things that are up these days is insurance. Do you handle all the different insurance companies?
We do. I wouldn't say all. There's probably thousands of insurance companies, but we do take the major payers, and we even have self-pay options for people who are completely uninsured.
And tell us a little bit more about some of the offerings. I know that one of the things that Allison sent me, and we've put it out for you a couple times, a lot of students need physicals to go back to school. And you've got a special going on right now. I don't know if you want to call it a special, but we're not supposed to do that type of stuff. But tell us about what you have to offer for the local students.
Go ahead, Brian.
So we offer a full gamut of physicals for sports, for school. We offer DOT physicals for people who need the DOT cards. We offer the full gamut of physicals, and we'll, if they can bring in their form, it's very easy for us to be able to fill out the form and send that with them. We do have generic forms if they need, but largely we do offer all types of physicals at our sites to fulfill the needs for either school, work, pre-employment, or DOT.
Well, one of the compliments that I've received about you guys so far, and you really haven't been open for a real length of time, is the athletic director at a couple of the local schools say that when they have, a slight injury during one of their sports games, a rolled ankle, as Brian said a minute ago, they can run them right down to you instead of having to, find the emergency room, either up in Milford, down in Attleboro, or around some of your other sites. That's one of the other benefits of Physician One there in Franklin.
That's right. We definitely have the ability to evaluate these sports injuries or just, the weekend warrior injuries. We see those all the time, and we can get the people in and out of our center typically within less than an hour. So, our turnaround time is really quick. Our cost, even for those who have cost sharing with their insurance, typically people have to pay a portion of the of the bill. We tend to be about a fifth of the cost of an emergency room visit. So really cost-effective care with really high quality. You know, we're staffed with board certified physicians, as well as very experienced physician assistants, nurse practitioners, and really incredible staff.
Well, since we're on the subject of insurance, tell us, what do you need to bring when you come to the urgent care? Besides identification, give us a little hint of what folks need to bring with them.
Yeah, so photo ID and insurance card are the two most important things. And then if they're coming in for a physical, it's really helpful to have the prior physical records and the immunization records to help us along. If we need to get stuff that the patients did not bring with them, we'll ask them to get it, and we can still take care of them. But we'll probably have to follow up. We may not be able to complete it at that moment if they don't bring it with them. So if you've got, you know, a prior medication list, past medical history list, and prior physicals for specifically if you're having a prior physical and immunization records are really important as well.
Well, where are some of the other locations of Physicians One? You said you have 20 plus locations. Are they all located around Central Mass, or where are we?
Go ahead, Brian.
So in Massachusetts, we have other sites in Chestnut Hill, in Waltham, Medford, and Westwood. Subsequently, the rest of the sites all lie in Connecticut. We have 16 in Connecticut and then 3 in New York.
Awesome. So you cover most of the East Coast along our Massachusetts coast anyways.
Right.
Anything that my chamber members
That's
definitely
right.
worry about is my chamber. Sorry, being selfish, folks. But we got to take care of our troops too.
Yep.
So what are the hours there in Franklin? Because you said, you know, that sometimes they need care off hours.
So
Go ahead.
Okay. So during the week, Monday through Friday, we're open 8 a.m. to 8 p.m. And on the weekends, we're open 9 to 5. And then we also offer 24-hour, 7 days a week telemedicine coverage, which, you know, we can see patients, you know, close to Franklin or across the entire state of Massachusetts, Connecticut, and New York on our telemedicine platform without even having to leave the home. So we have that available 24/7.
And the location in Franklin is very convenient, right off 495 and 140. My office used to be right next door, actually, where the physical therapy place was.
Okay.
We had it there for a little while. So can you leave us with a few more thoughts about why we should be going to Physician One instead of going to any of the local hospitals?
Sure. I'll give you my thoughts and then I'll let Brian give you some of his thoughts. You know, I think that not all urgent cares are the same. So although there may be other options, I think Physician One, and I'm obviously biased, but I think Physician One provides the highest quality of urgent care. And we have a very, very strong focus on the patient experience and making sure that the patient gets exceptional care, and that we make the patient know that they are a priority for us, and that whatever we can do to take the best care of the patient and make them feel good before they even leave our doors is what we aim for. So I would suggest that, you know, if people have a need for urgent care, including any illnesses or injuries, or even things that they aren't sure how or where to get the care from, that they come to see us. We can help them navigate the healthcare system. We also have a concierge type of system in which we have a nurse triage line who can help to direct their care and get patients where they need to be at the right time in the right place. If patients need specialist care, we can help to direct their care into a specialist that we work with if it's something that we can't completely take care of on site. So a lot of opportunity for patients, and we're here to help the community, and we hope to be able to do that for everybody.
Brian?
And my thoughts are basically we have a great team in Franklin. I mean, they're all about service delivery and making sure the patient feels comfortable, providing that exceptional experience from the minute that you walk in the door to the minute you leave.
Well, and that's so very important, because we know, you end up going to the emergency room, you're there for 4 or 5 hours, where when you go into the urgent care, you can be in and out in less than an hour. And that's important to an awful lot of folks.
Yep.
Well, folks, we're going to be doing a grand opening ribbon cutting at some point in the next few weeks. So you can come up, get a tour of the beautiful new facility that they have in Franklin, meet these fabulous folks face to face, and hopefully we get you to sign up at Physicians One. So
Thanks, Jack. We've
Dr.
really
Jamie,
enjoyed
Dr.
being
Brian,
here.
thank you very much for coming on the show today. Hang tight for a few minutes, and we're going to end the show. Folks, thanks for being here.
Thank you.
We'll see you again next week. And everybody, please stay safe.